Dr. June George obtained her MBBS degree from University of Mysore and postgraduate degree from UK. She was practicing in various government hospitals until 12 years ago. Then she joined private practice with Pantai Hospital, Sungai, Petani, in the Department of ONG. Dr. June's husband, PP Paul Selvaratnam, is from Rotary Club of Butterworth. Welcome, Dr. June. The audience is yours.
Thank you very much. Um, Good evening, everyone. I'd like to thank you for inviting me to share a bit about HPV and cervical cancer. I'm not sure whether you know what HPV is all about. And so let me just run through briefly what HPV is. Just give me a minute. I'll share the screen with you. Okay. Okay. HPV actually stands for human papilloma virus. Nowadays, virus is a very dirty word thanks to COVID-19. Well, HPV has also been not a very nice virus in our life. It is one of the commonest viruses worldwide. And not everything about HPV is bad, right? Okay, HPV has about more than 100 family members. It's like a huge joint family system that they have. Out of this, we have about 14 family members who are not very kind to people. Okay? Out of the 100, about 14 of them are what we call high risk viruses. And hence, they are the ones that are most problematic to not only ladies. You'd be surprised. The men would be wondering, what has this got to do with this? As we go along, I'll tell you a little more about HPV and how it affects men. As I said, out of the 100 family members, 14 are the ones who are the not so kind ones. And this HPV is actually sexually transmitted. So can you get HPV infection by touching someone's hand or by touching a table that they have touched? There's no way you can get that. Now, the good thing about HPV is that it clears up spontaneously for most people. That means from the time of infection, this is actually transmitted through sexual contact. That means from genital area to another genital area, or from genital area to your oral space, you can get HPV infection, right? So does that mean anyone and everyone who's sexually active must actually have HPV? No. It just means that those of us who have strong immune system, most of us will clear up. From the time of infection to about 2 years, 90% of these infections will clear up. But for those where it does not clear up, that's the one that causes problems. As I said, 14 of the ones are what we call high-risk HPV infections. The low-risk ones are the ones that cause warts. You know, in Bahasa Malaysia, they say ketuat. It's abnormal skin growth. It is ugly to look at, but beyond that, will this become cancerous? No. So that's a good thing about the low-risk one. And thankfully, the low-risk family members are much more than the high-risk ones. The high-risk family members that we are generally worried about are, okay, there's some numbers, 16, 18, 31, 32. You don't have to worry about it. But those are the ones that generally cause cancer. Now, cervical cancer, that is that has been diagnosed, nearly 90% of these ladies who have cervical cancer are the ones who've been infected with HPV, right? So I said they clear up spontaneously. Up to about 90% will clear up by 2 years. In the event it does not clear up, it persists, these will go on to cause cervical cancer. Does it happen after 2 years? Immediately after 2 years? No. The good thing about cervical cancer is that it really takes a long time to manifest, to show itself. So in that period of time, if we are alert and we are doing general screening, then we can pick it up early. And surprisingly, you'll be glad to know, in early stages, about 95% of cervical cancer is curable, which means survival rate beyond 5 years is there. Okay, now we've been talking about cervix. What actually is cervix? If you see this diagram, you can see that there's the uterus, and then there's a place where they have demarcated as cervix and one external os. Now, cervix is actually the gateway into the uterus. What is the uterus? There's the womb where the baby is sort of incubated for 9 to 10 months. That's the place. Now, the opening into the womb is what is known as cervix. The external os is where what we call ectocervix is. That's where most of the time we detect cervical cancer. And that canal in between, that whole area which is known as the cervical canal, is where the endocervix is, and that's also where cervical cancer can be found. Okay. The top right hand, what you see as cervix viewed from below, that's sort of a picture of the cervix that looks healthy. Now on your left, you see another picture. That's the actual photo of a healthy looking cervix. When I told my daughter, this looks beautiful, she looked at me like, what's wrong with my mother? If that is beautiful, what is ugly? What is ugly is the one that you find at the bottom right-hand corner. Can you see that not so pretty looking thing? Excuse me. Not so pretty looking thing around that opening? That's where most of the cancers start, okay? So at least you know where the cervix is. For quite a lot of people, cervix means, when we say cervical, they think of their neck because the cervical vertebrae, the cervical bones are there, right? So now this is where we are talking about now, all right? So what exactly are the risk factors that are involved as far as developing cervical cancer is concerned? Nowadays, more and more young people are involved in sexual activity. Okay, you'd be surprised. Once upon a time, maybe at my time, I used to think this early age of sexual activity is most probably found with the white community. Not so true anymore. You'd be surprised. A lot of Asians, even a lot of Malaysians now, young children as young as 10 and 11 are already involved in some form of sexual activity, right? So the earlier the age onset of sexual activity, the higher the risk of getting cervical cancer. What exactly do I mean by sexual partners? If that particular lady has numerous sexual partners, or she is a partner to someone who himself has numerous sexual partners. That means she's only in a relationship with one guy, but this guy seems to have a lot more sexual partners. They are at higher risk. Okay. Co-infection with sexually transmitted diseases, what are they? These are like what we call herpes infections, chlamydia, syphilis, gonorrhea, things like that. It means to say if your immune system is already down for whatever reason, getting a HPV infection makes that person more prone to get cervical cancer. The next one is immunocompromised. Who are these people? Those who are, let's say, on immune suppression drugs like steroids for a long time. Let's say they've gone for some transplants, or for other reasons they're on steroids, or those with AIDS, where I don't know if you're aware that pregnancy itself is a situation where the lady is immune compromised. The immune systems are down. Why? Because it is nature's way of maintaining that pregnancy. If her immune system is overactive, she will lose that pregnancy. So when your immune systems are down, they are no longer able to fight this HPV. As I said, it's one of the commonest viruses around. And when you get infected, anyone who's sexually active has a probability they've been infected with HPV. Why is it then that not everyone gets the cancer? Why? Because if your immune system is good, it fights off the cancers, those viral cells, and they get cleared up. So we don't get into this cervical cancer area. But for those who are not so fortunate, these are the ones who progress on to cervical cancer. Young age at first birth and number of children. The closer you are to menarche, that means the first time a lady starts to have her period, to the first pregnancy, and increased number of pregnancies will predispose this lady to having cervical cancer. Smoking, right? We're wondering, I don't smoke from down there, I smoke here. Why does it bother the cervix? It bothers the cervix mainly because once you start smoking, it affects your immune system. That's one thing. The next thing is that cigarette smoke contains a lot of substances that destroy the normal nature of cells. And hence, what is once a healthy cervical cell becomes distorted and more prone for viral attacks, right? And cervical or penile cancer. Now, if you have a partner who has cancer of the penis, this lady who has a partner with cancer of penis is a higher chance of getting cervical cancer. As I said, HPV infects both male and female, right? So how does it affect the males? Thank God, men don't have cervix. So you say, okay, I'm safe. But that's where you're wrong. It can affect your penis. And what we call anogenital, that means it can affect the penis, it can affect the anal area. So those with persistent HPV infection in men can end up with cancer of the penis or anogenital, right? Why is cancer of the cervix such a big deal? Because cancer of the cervix is the second largest cancer in women and the fourth highest cause of death in women as far as cancers are concerned. Okay, the first one is cancer of breast. Second one is colorectal, that means part of your rectum as well as your large bowel. Third is lung. Fourth is cancer of cervix. So among the ladies, this is the fourth highest cause of death and the second highest cancer in ladies, right? Now, does everyone who has early lesions of cancer of cervix have symptoms, not necessary. They have done studies which have said that for the time duration between the time one gets infected with HPV and to develop into a full-blown cancer, provided you are not immunocompromised, it'll take 15 to 20 years for cancer of cervix to develop. However, if you're immunocompromised, it'll take about 10 to 15 years. So the time there is long. And in this period, if we catch the thing early, it can be treated. Now, what are the symptoms that we are looking for? Abnormal bleeding. What do I mean by this? For a lady who's at regular cycles, she starts to have bleeding in between her menses, a period, okay? The periods become heavier, longer duration of bleeding. She has what we call as postcoital. After intercourse, she starts to bleed. And if that lady has menopause, she starts to bleed after menopause. And how do we define menopause? If a lady has not had her periods for 6 months continuously, I'm not talking about a 20-year-old, I'm talking about a 45 or 50-year-old who's not had a period continuously for about 6 months, we define her as having reached menopause, provided she has all the other symptoms. Now, after a year or two, she suddenly starts to have bleeding. May not be torrential, maybe a little bit. That itself is a pointer. Vaginal discharge. Is it uncommon for young ladies to have vaginal discharge? No. It is a common thing for a lady in a reproductive age group to have vaginal discharge. Now, what kind of discharge? Usually just after periods, they have a lot of clear, watery discharge. And then midway through the cycle, the discharge becomes gel-like, jelly-like, thick, sticky. That's normal. But here, what is the symptom? The discharge becomes more than usual. It can be blood-stained. It can be foul-smelling. And it continues. Pain during sexual intercourse. This is when the disease is a little more, what shall I say, a little more fierce. It has already spread a bit inside the pelvis, right? And then unexplained persistent pelvic pain, back pain, your legs start swelling for no reason, you start to lose your appetite, you start to lose weight. These are symptoms that says maybe the disease is already advanced. How do we treat cervical cancer? Early cancer, the cervical cancer is actually divided into 4 stages. The first stage and part of the second stage is what we call early cancer. Depending upon the age, depending upon the extent to which the cancer is present, and whether this lady has completed her family, most of the times the treatment is surgery. Okay, surgery, what do? Do we go in and take out the uterus for all ladies who present with cervical cancer? No. We just remove, sometimes it's just part of the cervix we remove, or we just do what is known as bone biopsy. As I said, if she's completed her family, or she's not interested in childbearing, and it is still very early, we give them options. Can we just get away with just removing the uterus? Yes. But if it has gone on a little more than stage 2, then it becomes a little more what we call extended hysterectomy. That means we take out the uterus, we take out the lymph nodes and all to make sure that it's not spread there. In case of advanced cancer, early cancer treatment is there and the survival rate is above 95%. In cases of advanced cancer, can we go in for surgery? Not all the time, no. What is the modality that we have? It's either chemotherapy plus radiotherapy or it's just radiation. But if it's too far gone, then there's nothing else that we can do except palliative care. Palliative care just means that we try and give the lady reasonable life, in the sense most of the time they are in pain, they have a lot of discharge, their quality of life is not all that great. So palliative care is to try and give them a reasonable quality of life. Right. How can we actually prevent the cervical cancer? We are very lucky. We have what we call this as HPV vaccine. There are 3 types now currently in the market. Cervix deals with the 2 most common family members of HPV family that causes cervical cancer, Gardasil 4 and Gardasil 9. 4 is the 4 most commonest family member that causes cancer, and 9, as its name indicates, is the 9 most common. Why was Gardasil 9 developed? Mainly because they realized Asians, we react a little more differently to these HPV infections. And the ones that cause cancer in Asians are not so common in the Caucasians, and hence is Gardasil 9. Who are the ones that are supposed to take HPV vaccine? In Malaysia, I'm sure you're aware all the school girls at the age of 13 and above will get vaccinated in schools. Now, I'm 20 and I have not been vaccinated. Can I get a vaccine? Yes. All these vaccines are 3 doses and they are staggered. That means one, let's say if you take one this month, the second injection will be next month, and the third one will be 6 months from now. Age range can vary anywhere between 13 to 45. Once upon a time, it was only 13 to 20, because that's the time when your body produces the maximum amount of antibodies. Thankfully, they found that older ladies, when I say old, I'm not talking about 80-year-olds. I'm talking something about like, I'm sure ladies who are 35, if I say they are old, they'll probably come after me after this. But as we say, advanced, a little advanced in age, we also produce good amount of antibodies. So they are no longer restricted to 13-year-olds. Up to the age of 45, any lady can go for HPV vaccine, right? What if you already have a pap smear that says, okay, you're infected with HPV? Does that mean you cannot get your HPV vaccination? You can. Are you going to have adverse reactions to this? No. Can a pregnant lady get a HPV vaccine? No. Let's say you've already gotten 2 doses and just before you get your 3rd dose, you get pregnant. Can we give your vaccination during your pregnancy? We actually don't. Okay? Now, does this mean that the men are not supposed to get vaccinated? Western countries, the boys are also vaccinated. Okay? In Malaysia, I'm sure you don't hear much about boys and men getting vaccinated. So is it wrong for a guy to get vaccinated? No. Because if you know yourself and you know you're not, your immune system is not all that great, please go get a vaccination done, right? Now, we're talking about routine pap smears. What are pap smears? Remember I showed you the picture of the cervix? What do we do during a pap smear? We just take out the superficial layer of those cells. Do we go and use a knife? No, we use a brush. We're not so terrible people, right? We just use a brush, scrape the cells off, and then we either dunk it in a fluid medium and send it to the lab, which is what we call liquid-based cytology, or we put it on a slide and send. How routine is routine? Do you need to do it 6 months? No. Once a year. What is the practice that is advocated by Kementerian Kesihatan here? If you have 2 consecutive smears that are normal, after that every 3 years once you go for a smear. Why do you need to do a pap smear anyway? I remember I told you that from the time that you have a HPV infection till the time you manifest cancer symptoms, it takes about 15 to 20 years. So if we find there's abnormality in the cell, then we would do appropriate treatment. Or that's a time when you're looking at the cervix and you think, hey, this doesn't look good, or there's an ulcer there. We go on to do what is next needed, right? So routine pap smears are advocated. Who is asked to go for a routine pap smear? Any lady who is sexually active. So does that mean a 13-year-old schoolgirl who is sexually active, are we going to do pap smears? In Malaysia, if I were to suggest it to the parents, they'd probably shoot me. Okay. Because it's like, no, my daughter won't do such a thing. Look, as Ms. Ramya told you, I worked in the government setup before. And we have children as young as 12 and 13-year-olds who are sexually very active. But because of our Asian makeup, we cannot even suggest that they go for pap smears because the parents will come up, how dare you insult my daughter, kind of thing. So anybody who is sexually active up to the age of 65 is asked to go for routine pap smears. Does that mean a lady who is above 65 cannot get cancer of the cervix? They can. So how are we going to find out? Some ladies are very concerned about their health. So even after the age of 65, they still go for pap smears. But there are some ladies who say, I'm already 40, I'm old, I'm not sexually active now. We're not talking about your sexual activity right now. We're talking about a few years ago. If you've been sexually active, even in a monogamous relationship, we never know what's happening in the cervix. It's one of those areas you never get to see, right? So the only way you find out what is happening to the cervix is by having a look at it. And how do we look at it? When we go for pap smears, right? Practice safe sex. This is like saying, try not to have too many partners sexually. And if there is a need to have many partners, for the males, it's always best to use protective barrier method. That means a condom is a safe thing. Does it completely avoid infection with HPV? No, because you can also get HPV infection from the anal region, from the scrotal region, from the labial region if the HPV virus is there. So does that mean if by using a condom you are safe? You're not totally safe. Don't smoke. That means those who are smoking, try and avoid. Those who plan to smoke, forget the idea. It's not a very good idea to start smoking. And It's not only direct smoking, secondhand smoke. If you have a partner who is a smoker, get your partner to quit. Because unnecessarily, a lady is exposed to all these oncogenic things that causes cancer. So the best thing is to avoid smoking altogether, right? That's it. Thank you. If you have any questions that you would like to ask, I'm open to answering questions.
Thank you, June.
Welcome.
Thank you, Dr. June.
You're welcome.
So, any questions?
You can unmute yourself.
Okay.
Ask any questions if you like. You want to stop sharing? So you're
Yeah.
okay. Can see you bigger now.
I think most are guys here. They don't know what to ask.
Okay, maybe I should say something at this point. We're wondering, what has this got to do with me, especially the guys? See, you have sisters, you have friends, you have family members who are ladies. A lot of our ladies are very shy. Even when we have medical camps, we go and offer them pap smears. They're like, no, I'm okay. There's nothing wrong down there. And that's all they tell you. They don't want you to even have a look at them. Even to examine a breast is like a big thing. So maybe you could tell them, go for a checkup. Not necessarily you have to go to a private institution. Kementerian Kesihatan, all the clinics conduct pap smears. It's regularly done. They have something new where they just test for HPV. Because some of these ladies listen to gory stories about how pap smears are done, and then they're like, oh, I'm going to get tortured. They're going to push something in, and then they're going to dig down there, and then it's mental torture even before you touch them. Okay, because I have ladies, the moment I put on my glove only, they're already in pain. I'm like, hey, I haven't even come near you. When you talk to them, you explain, and then you just get them to be comfortable, to just relax. And then once the pap smear is done, they're like, oh, habis ke? Dah sakit pun. That's the story. Okay? So get them to go. Kementerian now has got something else which they do to test for HPV. All they have to do is they're given like a long stick with a cotton swab. They just do it themselves, put it into a media and give it back to them. So if there is HPV infection, the Kementerian people will call you back and say, now you have to go to the hospital for further management, right? So get the ladies to go for regular checkup. And for those ladies who are below 45, go for vaccination. So, and you, I think, as a club, can always promote awareness about pap smears and regular screening.
When there's an abnormality in the pap smear, does it mean you have to do surgery? Or what do you have?
If there's an abnormality, some of it with just treatment with antibiotics would clear up. Okay. Some of it, when there are different readings that come up with it, ASCAs and things like that. Okay. ASCAs and things like that, then we do a procedure known as colposcopy, very high sounding name. But what it means is that we actually look at the cervix using a microscope. Then we apply acetic acid, in plain words, vinegar, on the cervix. See if it changes color, and if that area, wherever it becomes white, we take biopsies and we send to the lab. That's all. Sometimes just that procedure itself will get rid of the infection, right? So does it mean that you all have to go for surgery? No. Just now there's a question about whether you should avoid sexual contact during pregnancy. No. If I were to say yes, the husbands will come after me with a para. Okay. Yes, you are immunocompromised, but does that mean you should avoid sexual? That means you might well remain asexual throughout your life. That's the best way you can avoid HPV infection. But is it practicable? It's not. So there's no need to avoid sexual activity. If there's any abnormality, your body would try and fight it off. As I said, it takes up to 2 years. You're not going to be pregnant for 2 years. Thank God for that. Your pregnancy ends in 9 months, right? After which your body will take over. Not all HPV infections must end in cancer. The low risk ones are the ones that cause warts. And how do we know someone has warts? If that genital area has got this funny finger-like growths there. Looks ugly, but is it cancer? No. So do you need to avoid sexual intercourse during pregnancy? No. Any other questions?
Dr. Jun, for the pap smear screening test, from your experience, what is the percentage of people diagnosed with a positive result?
Okay, maybe about 5 to 10%. Because if you are able to pick up abnormal cells and appropriate treatment is given, it stops right there.
Oh.
Because that's the earliest changes that occur. Your body is strong enough, it'll fight it off by itself. Sometimes it needs a little help. And how do we help? Sometimes it's just by giving antibiotics, and that will clear up the inflammation, and that makes the cells go back to being normal.
I think it's very effective. Now the cervical cancer rates are so going down and down, and very low now.
It is going down, but unfortunately in Malaysia, we still don't have a high number of ladies who are screened. We have this machi from the kampong of those people from the estate who will come in at late stages. So the cervical cancer rates are still high as compared to maybe Western countries because they have a higher recall system. Here, most of it is hit and miss. Those who walk in, request for a pap smear, that's where you hit your target. Whereas some of them walk into the clinic saying, oh, I've got this bloody discharge, and sometimes it's smelly. Sometimes they come to you with, all of a sudden, I've been leaking urine, or there's fecal matter coming out from my private parts. That means the cancer is eroded either in front into the urinary bladder or behind through the rectum. That means there's a hole. So there's leaking coming out. Just now there's a question about HPV infection and dentist, is it? Sorry, can someone put up the question again, please?
Yeah. What are the chances that HPV can be transmitted from infected patient to the dentist? Are there any oral manifestations that we can use acknowledge or diagnose that the patient is infected if the patient failed to share during medical history? HPV.
I see no reason why HPV from a patient could go to the dentist. Unless, okay, you have HPV where if you have the low risk one getting into your mouth or around the mouth where you have warts, but that is very rare. HPV infection in the oral cavity due to oral sex is possible, but it's unlikely that the dentist is going to get it from the person, mainly because there is no direct contact with the dentist. When I mean direct contact means skin to skin contact, right? The dentist is going to be using gloves, going to be protecting themselves. So there's no way the dentist can pick up the infection. Are they going to manifest anything in the mouth? Are you going to be able to say, oh, this person has HPV infection of the mouth? No. Unless you're particularly looking for it. I don't think there's any oral manifestations per se. And the dentist need not worry, oh, A has got oral HPV or things of suspected oral HPV. Are they going to be infected? No. It's like you having a bath in the pool, the same pool that a HIV or an AIDS patient has had a bath. Okay. There's no way you're going to get HIV or AIDS from that pool. Same way, you don't get it by doing some service for a person with HPV infection. Sorry, I missed that question.
Yeah. There's another question. How to confirm the diagnosis of cervical cancer if the pap smear is doubtful?
If the pap smear is doubtful or is questionable, and grossly, that means by naked eye, we see that the cervix doesn't look good, we always talk to the patient, ask her to go for colposcope. That's where I said we look at the cervix using the microscope. Can it be done as an outpatient procedure? Yes, but it's rather uncomfortable because we're going to be putting vinegar, diluted vinegar. We don't take the off-the-shelf vinegar and dump it there. We dilute it because there's a strength which has to be used. And after the dilution, if there's any abnormality there, we will be taking biopsy. That means we pinch a bit of tissue. So normally, where do we do it? We do it in the operating theater. At least the patient is sedated. They're not so tense up. Oh, don't know what she's doing there, what she's digging, what she's cutting, what this. All that is gone. So we do that and we come up.
Dr. June, if I may ask a question, thank you for addressing this issue. I wish I consulted you earlier. I lost my mom to cervical cancer about 35 years ago. Now for men, cancer to prostate, what is your advice? When the ladies can do pap tests, they can do the breast examination. What is your advice for men to look after themselves and to look at prostate cancer? Thank you.
Well, prostate cancer is usually for those who are above 50s, 60s, right?
That's
and
me.
When,
thank you.
Okay, men after 50s and 60s usually undergo hypertrophy of the prostate. The prostate gland becomes a little bigger. You have a little difficulty in initiating, I mean, starting a urine flow, and you have problems passing urine. So there are blood tests that you can do, but is it confirmative? Not really. If you have problems passing urine, the best thing to do would be to go and see a urologist who will do a prostatic examination for you. I'm sure even Bernard does a prostatic examination. Just like cervical cancer, prostatic cancer is also slow growing. So if you can find it early, excuse me, surgery I think would be a very good option, and cure rates are fantastic. It's just that most of the men think of it as, okay, part of growing old, so let's not bother about it and things like that. And then by the time they actually go and see someone, it's a bit too late. It's already spread somewhere. Bernard?
Thank you. Thank you, Dr. June.
Okay.
For prostate cancer, there is a prostate-specific antigen. There's a tumor marker that is useful for screening. Not all tumor markers are actually useful for screening, but PSA is quite useful. We do it every year, age of 50. If it's abnormal, then they go for biopsy by the urologist. Yeah. Okay, there's another question here in the chat. Can get vaccination at Pantai Hospital?
Oh yes, you can. All three of those vaccines are available. If you ask me the price, I'm sorry, I can't tell you offhand what is the price. You can always call up and we'll be glad to let you know. The cheapest is Cervarix because it's bivalent. It covers the HPV 16 and 18. Those are the two commonest cancer-causing family members. Okay, and the Cervarix 4 and 9. 9 is the most expensive. That's the most recent vaccine that has been developed. That's also available. But all three, you require 3 injections.
So how do you advise patient which vaccine to take? There are 3 types, right?
We tell them which are the family members it covers. Ultimately, the patient decides because, as I said, all 3 have different price ranges. Okay, and we tell them, okay, this is what it does, this is the cost, and they ultimately will make the decision. So now that we have Cervarix 9, a lot of them go for that because they think, okay, wider coverage, why not?
Thank you.
There's a question in the chat, Dr. June.
Uh-huh.
Do you ever come across patient practicing oral sex, and what are the common complaints they usually have?
Okay. Patients who practice oral sex will not tell you that they're practicing oral sex. Okay. But what will happen is that those with oral herpes, okay, does that mean all persons who get oral herpes have practicing oral sex? No, but those who have herpes around the mouth, and when you check the genital area, that area looks a little bit different, then you know they are. So what do we tell them? If they come to you for a particular reason, they say, oh, my down there is itchy, or it's painful, or I'm having painful sex and things like that. Then when we look here, then we just tell them, okay, by the way, I think this is what's happening. You need to do further testing. And your oral herpes simplex, you get all these ulcers and things like that. Most of the time, if we find ulcers there, we advise them to go get it biopsied because we don't know whether it is due to herpes per se or something else is sitting there and we are just assuming. But most of the time, our ladies will not admit to oral sex unless they have a horrible husband who's been abusing them. Then they come right and they're out to get his gut. So they'll say, oh, this fellow has been doing this, then yes, otherwise no. Okay.
Any more questions?
No, thank you, Dr. June. That was a most comprehensive coverage on the topic. Thank you so much.
You're welcome.
Okay.
Thanks, June.
Okay.
You're welcome.
Okay.
Okay. Very big thank you to you, Dr. Jun. I know you're a very busy person, still taking time off to join us this evening. Rotary Club Bandar Sungai Petani is truly grateful for you and the Pantai Hospital for your constant support to our club. Thank you.
Any announcements?
Nope, I think. Okay, members of Rotary Club Bandar Sungai Petani, please stay after the talk. We have some meeting going on later. Thank you. Okay,
Thank you, President Kai Hong, for having us.
Thank
We
you.
will leave you all to have your meeting. Thank you so much.
Okay.
Thanks, guys. Thanks, Dr.
Okay.
June. Thank you. Thanks, everyone.
Okay, thank you.
Bye.
Good night, everyone.
Bye.
Good night. Thank you.
Bye.